If you're thinking about applying for your oncology specialty certification, then you're definitely going to want to watch this. In this video, I'm taking you step by step through the ABPTS Oncology application, including what to expect, what goes where, and how to avoid the most common mistakes in your application. Let's make it easy and let's get your application done. So, what we're going to start with is the ABPTS website homepage. Now, at this homepage, you're going to see a lot of information. What we're going to do is we're really going to focus on the oncology side of things because if you're here at the OncoPT, then you're interested in oncology. So, what you're going to do is you are going to go up to the top and you're going to select this Become a Specialist section here. And we're going to scroll down to the oncology section and select this. Once you're viewing the oncology section of the website, again, you're going to see a lot of information, but we're really going to focus on a couple areas here. Once you scroll down a little bit, you're going to see this Ready, Set, Go area. And what I would recommend is before you start your application, before you even start thinking about your case report, you need to look at the ABPTS Candidate Guide. This document is a complete overview of the entire process of becoming a board certified clinical specialist. So what I would do, again, check this out, make sure that you feel super good about all the requirements. And then once you've done that, then it's time to actually look into the application. So we'll go over to this section entitled Go and click the link here to actually open up the application portal. You'll then log into the application portal. And once you're here, you're going to see a screen that contains all of the applications for all of the different specialty areas within physical therapy. We're going to scroll down to the oncology section. Again, your view should look very similar to mine, and you will click the button that says Start Application or Begin Application, whatever that looks like on your end. Now, we are going to start first with the Select Your Path. This is the first part that you have to do as part of your application. Now, in order to be eligible to sit for the Oncology Specialty Certification exam, you have to do one of two things. You have to complete a residency in your specialty area, in this case, oncology. It does have to be accredited. Or what most physical therapists, including myself, will do is that they will select the PT experience path. And so this is where you have to demonstrate that you have patient experience in this specialty area, oncology, and you have to be able to log the number of hours that you have done in this specialty area. Now, ABPTS requires that you complete a minimum of 2,000 hours of direct patient care within your specialty area within the last 10 years. And of those 2,000 hours, 500 of those hours have to be done within the last 3 years. So this is making sure that not only do you have experience in the specialty area, you also have recent experience working with the specific patient population. So for most of us, we are going to select this path, which is the PT experience, and then it will prompt us to actually put that information in on this next section of our application here. So once you've selected your path, we're now going to open up the PT experience side of things. Now I'm going to show you what it looks like to input info from one job that you have had, one position that you have held during this time. But know that if you have multiple positions that you're going to be pulling this experience from, for example, like you worked at a place for a couple years and then you moved on to a different place, the process is still the same. What I would recommend, and also what ABPTS explicitly recommends, is to start with your most recent position and then work your way backward, because ultimately that's going to mean less work on your part if you start with current stuff instead of starting at the very, very beginning of your career. Now, at the bottom here, you will see that there is an area where you will put in your description of duties. I like to think of this as what you would put on your resume or your CV for this particular position. I have a pretty generic phrase that I used here that I actually used on my application for my initial certification, and then when I did my maintenance of specialty certification cycle 1 this past year, and it works. You are welcome to use it. You're welcome to come up with stuff on your own, right? Whatever best fits what you actually do as part of this position, you'll put this here. Once you've finished with this first screen here, we'll hit next, and this is going to take us to where we're really starting to dive into those direct patient care hours, like what kind of experience do you have in this position? So you'll see here that it brings forward information that you already put into the last screen, and it's going to actually help you calculate how many weeks that you've been working at this position. Now, ABPTS knows that while you may have worked this many weeks technically per year, there's 52 weeks per year, for example, you may not have worked exactly that. Maybe you took some vacation here and there. So it's asking you to subtract the number of vacation like weeks that you've done from this total that it's calculated. And then it's going to ask you the average number of hours that you worked at this particular institution. If you work full time, it's probably, 40 hours. If you worked more of a part-time position, then of course you would put those hours in there. Now it's going to ask you to kind of piece out how much time you actually spent in your specialty area. Now, if you are an oncology only physical therapist, you don't see any other patient population in your practice, this part's going to be easy because it's going to be 100% of your time. But you may be in a position where you treat other patient populations. And so, whatever your best estimate of how much oncology time you spend in your practice is what you're going to put here. Now, this next part here is actually the direct patient care hours. And what you'll see is that ABPTS has a link you can visit to determine what constitutes direct patient care hours within your practice. Now, of course, if you are treating patients, that is direct patient care hours, but it also includes other things that you may be doing as part of your practice. So, for example, like chart review, documentation review, and a few other tasks. And again, I'm going to have you visit this link that I have indicated here on the screen to get some more information on that. Once you've done this and you've checked that everything is correct, you are going to select the main areas or impairments that you tend to see as part of your practice. ABPTS requires that you have at least 3. I would try to shoot for 5. That seems to be the max, or like a little more of a robust indication of like what kind of patient population that you're working with. Again, I'm sure it's to verify that yes, you do actually work in oncology, but also to get an idea of what are oncology physical therapists actually treating out in the field. And I'm sure that's used for some kind of like internal research. I don't know this for sure, but I have an idea, like I have a suspicion that that's probably what they're using that for. You'll hit next, and then this is going to navigate you to the actual supervisor attestation part of your application for your experience hours. If you work at an institution where you are not the supervisor, someone else is your boss, you are going to put in their information above here. So it's going to be their name, their title, their contact information. And then you're going to see a section here that says, is this a self-attestation? Now, again, if you're working for somebody else, you're going to hit no. But if you're in a position where maybe you're self-employed, maybe you are the supervisor, for example, you would be the one to attest to that. You would actually select the yes option here. And again, you'll see here at the bottom whether this is a self-attest, whether this is a send the auto-generated email to your supervisor, all from this screen here. Once you have input this information, again, depending on if you're doing self-attestation or your supervisor attest to this information, you will click the corresponding button here at the bottom. Now, once this happens, it is going to then close this dialog box. You have the option to add more experience positions, right? More of your clinical experience here. If this one does not suffice the 2,000 hours with 500 of those hours within the last 3 years. So you would just continue that process until you get to the necessary number of hours for your application. Same process. It's going to walk you through the same thing. And what I do really love about the application, it calculates your hours as you submit them, either through self-attestation or by sending that information off to your supervisor. So it's really nice. You don't have to do a lot of crazy like mental math in order to submit this application, which we love here at the OncoPT. Now, the last part of your application, again, once you finish all of those experience hours sections, is your case report. Now, please hear me out. Please hear me when I say this. You should not be writing your application in these dialog boxes. Your case report should be done by the time you go to put your case report into the actual application. And I think when you see what I'm about to show you, it's going to make a lot more sense why we recommend this here at the OncoPT. So what you're going to do is there's these different required sections of your case report, and you're going to open them up one at a time. So we're going to start with the title because it's at the very, very top. So you'll open up the title dialog box here with this complete entry button. And what I would recommend is have your case report open in one, internet browser window, and then have this application right next to it in a different browser, because what you're going to do is you're going to copy and then paste each of the required sections of your case report from whatever, word processor doc you have into this application. That is the easiest way to make this happen. And there's a few different reasons for this. If you've gotten to this point in the video, you know that this application portal is notoriously slow. You're going to see this spinning wheel of loading all the time with this application. And the unfortunate part of the application portal is that if you are inactive for a certain amount of time, it's going to boot you out. So if you are trying to do stuff in different windows or like track stuff down, you are going to get logged out of the portal and have to log back in. And again, that is more of your precious time that you don't have time to waste at this point. So that's why we recommend make sure everything is ready to go, pulled up on your screen here so you can just copy and paste and go. So copy your title in, paste it into this window here. And what I would recommend is don't click the submit button yet. I would do the finish later button, and I'm going to show you why. So I'm going to click the submit button. And once it pulls us back to the application main page here, I am not actually able to edit the title that I have submitted because I pushed that finish or submit button. It's done. I cannot make any changes to this. So what we recommend is go through your application and do finish later on all of the case report sections, because then you can always go back through and double check, make sure everything is golden before you actually submit your application. So I'm going to open up the next section so I can show you what that looks like here. So in this next section, again, I'm going to copy and paste my information into each of these boxes here, and I'm going to hit the finish later button. Now, once I do that, and again, it pulls me back to my application kind of main page here, you'll see that I can still go back in and actually make edits as needed. Now, this is useful for a variety of things. Again, I love to check things before I submit them. You will also see, and this is something that you may have to work with on your application, it is copying and pasting my case report into these boxes automatically as bolded. I would make sure to change that. I don't really know why it does this. It's not bolded on my other screen here, but if you are asked to do any kind of corrections on your case report, they are going to have you go back in and identify those changes. And what I did is I actually bolded them on the back end when I resubmitted my case report. So it's not a requirement. I think it's just going to make it a lot easier if you make sure it's not bolded when you actually submit your case report. So you will literally continue this process all the way down through all of these sections of your case report. Now, I'm going to pull open this narrative of case section because sometimes within these required sections of your case report, there's multiple text boxes that contain different information. And you'll see that if you're in Case Report Writing Workshop, our template is built to match this application. So you can literally just copy and paste all of your stuff into this. But you need to make sure that what you're copying and pasting in actually matches what you're supposed to be writing about. So again, that's why we recommend the finish later, not the submit on your case report, just to make sure everything is good to go before you actually submit it. So you are going to continue this process until you have your entire case report copied and pasted over into each of these dialog boxes within your application. Now, once you've done that, there is going to be a button at the very, very bottom of your screen, bottom right of your screen, that is going to change colors. And it's going to say something like submit application or pay fees and submit application, something to that extent. Now, what is going to happen is once you finish this part of your application, again, we do recommend that you go back and check everything, right? Do a final check before you actually submit. This next button is going to navigate you to a different page where you are going to check out. You're going to pay the fees to actually submit that application. And then there is one final submit button, and then you're good to go. The application is out of your hands, and at this point, we are just waiting to hear back from ABPTS. Now, the sooner you submit to that July 1st deadline, generally the faster you're going to get your application back. I actually have already had, as of today, I have already had a couple students who have heard back on their case report, some of my case report writing workshop students who already heard back, they're accepted, they're good to go, which is incredible. Now, the closer you submit to that September 30th deadline, generally there's going to be more applications, which means it takes them more time to go through all of the applications. Probably it's going to take longer to get your application back. That's just the name of the game. That's just how things work. Generally, we're told to expect like 6 to 8 weeks. I did have some students in the past year who it took almost 12 weeks for their case report and application to get back. So please just be aware of that. This is an extended time period that we're waiting to hear back. So don't be surprised if you receive the auto, message email saying, hey, we got your application. It's out of your hands. You've done everything you need to. And until ABPTS reaches out to you with other information, there's nothing more for you to do. So just know, like, it is a time consuming process. It is going to take a while for you to get that application back. There are real humans behind the scenes who are reviewing your application. So again, be aware of that. Just take a deep breath, let it out, and enjoy your summer while you're waiting for that application to get back to you from ABPTS. If you've gotten to this part of the video and you're saying, okay, I feel good about the application, but that case report is kind of scary, listen up, my friend, because the case report is definitely the hardest part of your application, which is why Case Report Writing Workshop, our signature program, gives you the exact framework to plan, write, and actually finish your case report without the stress, second guessing, or burnout that so commonly accompanies this process. You can join Case Report Writing Workshop today and get the support you actually need to submit your application and case report with confidence. The link is in the description below, and I will see you inside Case Report Writing Workshop.